Hi friends, Dr. Nancy Tremblay here, Tremblay Chiropractic, putting the power and knowledge of your health back in your hands. We are going to talk about the SCM muscles here. It stands for Sterno, clydo, mastoid. Sternum, clydo, clavicle, and mastoid. That's this bump on the side of each side of your head. So these are individual muscles. You have a left and your right. These are sneaky muscles because you don't often have pain here when there's a trigger point or a spasm here, but they can create some definitely painful issues. These muscles, when they have spasm or trigger points, can create pain behind your eye like a migraine, stabbing pain. They can create a pain that wraps around the top of the head to the eye. This muscle, when it has trigger points, can also cause ear pain, a stabbing ear pain. Also, vertigo and balance issues. That is not from anything else but these muscles. I'm going to show you how to work on these muscles so that you can continue the work that we're doing here at the office at home. The way you find this muscle is you want to kind of grip right here, and you notice if I tense that, you can see it pop out. That's the muscle, and it starts all the way down here at the collarbone and goes all the way up to the point in my skull right here. You work on one side at a time, and just like any trigger point, you look for the sore spot, you look for the trigger point, and then you hold pressure for 10 seconds. So what I'm going to do is I'm going to turn my head to the opposite direction, and I'm going to grip. This is a slippery little muscle, so you have to grip. You can't just press, you have to grip. So I'm gripping with my index finger and my thumb, and I'm working my way up the muscle. And when I get to a point where I feel that there's some discomfort and pain, I'm going to squeeze that muscle and hold it for 10 seconds. Here's the other thing. There's a superficial layer to this muscle, and there's a deep layer. So sometimes you have to grip pretty deeply to find that trigger point. You work your way all the way up the muscle, holding those sore spots for 10 seconds along the way. And you need to work all the way up to the base of your skull, right there. Now make sure when you're holding pressure on these trigger points that you breathe 3 seconds in, 3 seconds out. A deep breath, because oxygen will help that muscle to release. When you're done with the one side, you might need to work on the other side as well. So it's the same thing. Turn your head away from the muscle, grip, look for that trigger point. When you find it, hold 10 seconds of pressure, breathe deeply. Make sure to only do this once a day. If you work on this muscle too much, it will inflame, and then you'll have pain from that. That will help you with the headache, the eye pain, the head pain, the vertigo issues, and you can continue the work that we're doing here. If you have any questions, as always, ask. Putting the power and knowledge of your health back in your hands. Bye for now.